Since their first conceptualizations in the early 20th century, autism spectrum disorder, characterized by difficulty in social interactions and communication, and by restricted or repetitive patterns of thought and behavior, and attention deficit hyperactivity disorder, characterized by attention difficulties, poor impulse control, and overactivity, have been perceived as predominantly or even exclusively male conditions. So, what does this mean for AFAB individuals when the understanding of these disorders have been studied primarily in AMABs and understood from a male perspective, without the consideration of gender bias? The ratio of male to females diagnosed with ADHD is approximately 4-1, and the ratio for ASD follows. However, there is growing evidence and understanding that the ratio is not a result of prevalence, but rather in diagnosis. These conditions being perceived as intrinsically a male condition means that AFAB people are underdiagnosed, and when they are diagnosed, the average age is much later. These conditions being understood through an AMAB experience means that us AFAB individuals are compared to our male counterparts in our symptoms and behavior, even though symptoms manifest differently in AFAB individuals due to the increased tendency to mask symptoms. Females with these conditions are constantly being discredited in our experiences with being neurodivergent, with comments such as, "You don't have ADHD because my 5-year-old son has it, and you don't act anything like him." Yeah, because I'm 17, and I'm not a boy. Or, how could someone like you possibly have autism if you're making eye contact? Maybe because people are forced to, otherwise you're ashamed in our society if you don't abide to the norms. This is especially true when you are born a woman. See, the underdiagnosis and underrecognition of neurodivergency in women is due to the medical industry's historical sexist understanding of the condition. However, to more specifically see why AFAB people tend to present less external symptoms, we need to look at the larger effects of being in a patriarchal society. See, from birth, men are praised for being loud, speaking their mind, being strong, and having leadership qualities. Men are praised for taking up space, whereas women, on the other hand, are rewarded for staying slim, being polite, and taking care of others. Women are praised when they make themselves smaller. So yeah, I do not act like your son, because my whole life I have been told not to. When I can't sit still, I was told to have patience and that it wasn't ladylike to squirm around. Whereas your son wasn't told anything at all. Rather, you brushed off his behavior as, he just needs to blow off some steam, or boys will be boys. This difference in treatment between AFAB and AMAB individuals is what causes AFAB people to feel they need to suppress their behaviors, learn to internalize feelings, learn to make the appropriate social responses by making eye contact and using pre-learned bodily and verbal responses, or mirroring others' behavior when the situation calls for it. We think that in order to be accepted, we need to camouflage our condition to suit social norms. So like many other AFAB people with neurodivergence, I gave in to the world around me and believed that I was the problem, that I just needed to apply myself, or start using a planner. But of course, nothing helped. You see, this is where it can get really dangerous. Because of the internalization of ADHD, ADSD, learning disorders, and other neurodivergent symptoms in AFAB individuals, there are detrimental effects. We are far more likely to struggle with anxiety and depression. People are far more comfortable with the idea and diagnosing AFAB folk with anxiety and depression rather than ADHD and ASD. This often leads to misdiagnoses that these individuals are dealing with exclusively mood disorders, which are often played off in AFAB people as them simply being moody or blaming it on hormones. However, even once diagnosed with a disorder such as ASD, ADHD, AFAB individuals are still far less likely to receive the help they need because the severity of their condition is underplayed by others. When parents are informed of a child's specific learning disorder, their reactions aren't of relief. The reaction isn't, "Great, Now that I know my child's brain works differently, I can use this information to help them. Rather, they are often negative and dominated by feelings like loss of hope and rejection. This reaction is often why people neglect the importance of diagnosement and treatment, and why there's a collective ignorance on neurodivergent issues instead of a focus on implementing accommodations for those who need it. AFAB people who are either misdiagnosed or had a late diagnosement of ADHD are more commonly to have self-esteem issues, as well as show greater participation in risky behavior with more dangerous outcomes, such as substance abuse, self-harm, risky sexual decisions, and auto accidents. Late and misdiagnoses of autism show higher rates of sexual abuse and exploitation. Neurodivergent people show higher levels of suicidal idealization, plans, and attempts. It is absolutely imperative that we encourage greater research into this topic so that disorders such as ADHD and ASD can be better understood in AFAB people, and as a result, the gendered issues surrounding become increasingly smaller. The consequences are too high if we don't.